So how do we approach this differently?
And it's great that we have all of these programs that are important, but I think it's a little bit of a cultural reset, and that cultural reset starts with embracing the concept. Even I understand why organizations don't want to do this. They maybe are worried about things like litigation and all that kind of stuff, right? But identifying the idea that work can be hazardous to our health, including the work that involves you just sitting in front of a computer, right? And how do you go about taking steps in order to be able to mitigate that? And ironically, steps might be one of the things you do, right? But I think that this is, again, if you look about the challenge we have here, the programmatic stuff that I was talking about, that's done at an organizational level. A lot of what needs to happen here is actually much more local than that, right? It's what happens in your group, it's what happens in your team, and it's what happens for you as an individual. So we've got to kind of localize this idea of healthy work practices, and we need to embrace it as a critical part that allows us to be able to do good work.